Number 11, Dr. Paul Hutchison.
Thank you, Mr. Speaker. My question is to the Minister of Health. What investment has the government made?
Order! Now, I've called Dr. Paul Hutchison to ask question number 11.
Thank you, Mr. Speaker. My question is to the Minister of Health. What investment has the government made to increase the number of kidney donor transplantations in New Zealand?
Honourable Tony Ryle.
Mr. Speaker, an extra $4 million has been allocated to establish a national renal transplant service to increase the number of kidney or live kidney donor transplantations over the next few years. The target is to increase transplants by 10 per year on year over 4 years, which will mean an extra 100 people will receive kidney transplants over the next 4 years. The new renal transplant service will be led by doctors, nurses and renal transplant experts and will help us better coordinate and improve transplantation services across the nation.
Supplementary.
Supplementary question, Dr. Paul Hutchison.
Thank you, Mr. Speaker. Why has this government made investing in kidney transplantations a priority?
Honourable Tony Ryle.
Mr. Speaker, it's part of a wider plan that the government has had to improve organ donation rates in New Zealand, and the new service includes specialised staff to support donors and recipients throughout the transplantation process, from providing education to interested potential donors to organising blood tests and carrying out pre-surgery preparation. This increase in funding...
Order. I apologise to the Minister, but it is difficult to hear because the member's talking and addressing the person who's asked the question. It's very difficult to hear the answer.
Well, Mr. Speaker, this investment is part of a wider plan that this government has to increase the rates of organ donation in New Zealand. And it builds on an investment that was made in Budget 2012 of $4 million to improve donation services. And this additional $4 million will provide new services such as specialised staff to support donors and recipients, from providing education to interested potential donors to organising blood tests and carrying out pre-surgery preparation. And as I said earlier on, this certainly is yet another part of this government's plan to increase kidney transplants in New Zealand.
Question number 12, Honourable Ruth Dyson.
Thank you, Mr. Speaker. My question is to